Welcome everyone to DT on Call, which is a conversation series by DialogTech. Today's a very exciting day. We have a special guest of Chris Pace, the Senior Director of Digital Marketing at Banner Health. I'd love to hear about some of the things you've learned about your patients along the way, since March, that have surprised you, because I think you've had to change, you've had to adapt in many different ways for all obvious reasons. But did anything surprise you to say, I thought they wanted this, or I thought we should communicate in this way, but yet their preferences or their tastes or their expectations are actually much different? What were some of those, surprising things?
Yeah, so I think, there's two things that come to mind. The first thing is the noisiest folks on social media aren't necessarily the majority. And, from everything about, COVID's a hoax to, the hospitals are out to make money on this. And that's why they manufactured this pandemic. And then now we're dealing with, the anti-vax folks that are trying to get in the way of us ending the pandemic. And, I'll say that the research shows that the majority of folks don't share the same sentiment that the loud people on social, particularly Twitter. Twitter's kind of a viper's nest for this. And, we listen. I mean, we have our research team actually scrapes Facebook and Twitter, whatever's public facing, and kind of, puts out there hey, this is this is trending right now, and we'll kind of echo it in the call center. And we just proactively put something out, either with our with Dr. Bessel, or our earned media might put out a story. And the interesting thing, again, using data as a guide, we knew that our consumers in the markets we serve trust health system and doctor by far more than anything else going on right now. So if we can leverage the trust and get the right information about safety and, the truth about what's going on, then that will muffle the noise that's happening on social. So it was really interesting because, I'm a little aware of all the things that go on, even pre-pandemic. Just following along, I'm like, oh, these Facebook friends of mine probably shouldn't be friends anymore because I don't know what they're drinking. But this is amplified it. But the good news is that most people, they're tired of COVID for sure, but they're still leaning in on what are the doctors doing? I want to see what my community and my doctors are going to do first, and then make those decisions on how they're going to care for their family. So that's number one. Number two was telehealth. We launched, we didn't have a consumer facing telehealth solution. We had telehealth in our, acute care settings, and, we had remote patient monitoring, and telehealth's been around for, 40 years. It's been phones to fax to devices that you wear to now it's, what people associate it with now is that video visit, the one-to-one like we're doing right now. And, so in April, we fast-tracked telehealth. And, my initial assumption was, I think people are just going to still want to see their doctor, especially the aging population, not understanding technology and not, it's just different. And there's too much else going on to adapt to something new. And what we learned was, man, consumers can adapt just as quickly as we do as consumers of other things. Mm-hmm. So, when DoorDash came out, and then Postmates and Uber Eats, there's a bit of a learning curve, but then you just get it. And now all of a sudden, it works. And now it made the pandemic a little bit more tolerable. Mm-hmm. You don't have to just cook pasta every day. You can actually dine out still in. And, telehealth was really interesting because, I've been using telehealth for years, but, I'm also a digital nativist, and, I talk about this stuff and promote it. So I better be one of the ones that uses it. But, like my parents and others that are in their 60s and 70s, I mean, they're using it too. And our physicians, is interesting, an interesting pathway, because they tend to be resistant to stuff like this because, they really value the face-to-face. And, again, it's something different. And I mentioned earlier, do it with us, not for us. Telehealth launched, sort of out of necessity, but it was a little bit of a for us moment. And we had to kind of level set with them. And, it's not necessarily replacing the in-person. It's another path, just like your example of walking out of the doctor's office and having to choose your own adventure on how you wanted to schedule your next visit. You also could have done a telehealth visit as a follow-up if that provider that you saw had that option. And, I think just opening the door to options and letting the consumer decide instead of us, the big health system, dictating these are the paths you go. I mean, we still need to have that control because, obviously safety needs to be part of this, and clinical efficacy and all those things that matter from a care setting standpoint. But, if we can sort of right size that in every channel, then choice can be delivered at scale and in a much easier fashion, which allows us to make healthcare easier so life can be better.
There you go. Well said.
That mission statement always comes back.
Yeah.